at least if you can understand what you need, you know what help you need to get. So that's the issue. So the first part of the self-management is the how, the why you have. So it's like aging, why you have these problems. So just to get it fresh in your mind, today's topics, I'll cover a brief anatomy. We come back to the muscle again and again. We go through something called polio and understanding the damage polio caused you. Normal muscle, how it works, normal muscle aging, so it's all repeats. Then I home in on changes particular to polio, changes that affect you, and then something on anatomy and posture. So just a basic, don't forget, we are essentially a bag of bones. Every bone in that skeleton you have. Okay? Now that bone is covered by wonderful muscles. Every muscle in those figures you have. Now what you must understand is the body has muscles in layers, so it's not just what you see on top. So when you have a pain, it could be any of the structures from the bone to this muscle on top to the muscles underneath. The picture on the left of you, that's what you see as surface anatomy. If I take the top layer of muscles away, you have further muscles, deep muscles. So that is why it's very hard to treat a person just by saying, oh, I've got a pain here. We really do have to assess you to see at what point the pain is coming from, whether it's a muscle, joint, or ligament. Is it a deep muscle or is it a superficial muscle? Then we have the organs that are inside the skeleton. And remember that on top of the skeleton is your muscles. So essentially, I suppose the skeleton is there to sort of get these organs all in place. Then you have blood vessels. The blue and the red are blood vessels. And nerves. Nerves follow those blood vessels. So if you see how complex the system is, which is why when you point to a spot and say that hurts, it is not as easy as just putting a hot pack on that spot. Because that pain can be coming anywhere from your spine to a muscle, from an organ. And that's what the medical training and the physiotherapy training is all about. Is this pain coming from an organ that's deep-seated? Is this pain coming from a joint, a ligament that's over the joint? Is it coming from a superficial muscle or a deep muscle? Is it coming from the blood vessels? Is it coming from the nerves? It is complex, but that's what we do 4 years training, so we should know. Right. Now you've got to understand how muscle structure works. Your muscles are not simply one muscle. A muscle, that's a nice picture on top, consists of a number of those bundles that's coming down, and each bundle consists of smaller bundles, and each of the smaller bundles consists of a strand. Okay? That is a muscle. It's like a wire within a wire within a wire, quite a complex layer. It's like a Meccano set. At the smallest unit, it is, I said it again, it's actin, myosin, those words. They're just protein. To build up that small structure at the bottom, which is the basis of the muscle, you need to understand your body must process protein to build up muscle. That's how muscle is built up. It's built up at this level, so each of those strands, as it goes up, it gets bigger and bigger. Okay? So a muscle is complex. So again, the same thing. You may say your pain is here, you may say your pain is here. Whatever it is, it does take a bit of training to work out where the pain is actually coming from. And when you are exercising a muscle, that's what you're building. You're building up the smallest wire right up to the biggest wire. And each of those wires, the bundles, are made up of your fast and slow acting fibers. Okay? Remember that fast and slow that I have been mentioning. Let's go back to the polio itself. What you see there is normal connections between brain signals and brain signals to muscle. So this is only the motor pathway. This is the coming out pathway. So there's a pathway from your muscles, from your skin to the brain. It's conducted by nerves, and the nerves are like telephone wires, very fine, finer than fiber optic wires, very, very fine. Okay, these are fine, and bundles of them send signals from your skin to the brain. The brain processes it. Every part of the brain is approximately responsible for a function. So the front part of your brain is for the thinking, roughly. Where the black dot is, in that sort of areas where your movement is controlled by. Just behind the movement area is the feeling part of your body. So that in that part of the brain, right at the back is your optic. That's where the vision and eyes are. And that little bit like a tongue, that's where your hearing and speech come from, right? So, but the human brain, and it's mimicked exactly the same on the other side. But the brain works by integrating. It doesn't work by one circuit. It's not as if you switch on one switch and only that pathway works. It works by the front, the back, the side, every part working together. It's a very complex system. So that is why sometimes it's not as easy as I did this and I didn't get that result, okay? Because there's more to this, which is why falls is so complex, because it integrates, as I said, I went through, you're a false risk. If any of what I've mentioned is not integrating and working efficiently, okay? So if it's not, then you use an aid to make your movement safer, okay? The other thing about falls, if you keep falling forward and hitting your head here, you are affecting the thinking part of the brain. Please take it very seriously. If you keep falling backwards, you are hitting the vision part of the brain. You may still see vision, but there are other pits that gets, you may cause other complications. I'm not here to frighten you, but it is. The brain is very delicate, and it's surprising how often people can hit their head and not affect it. Now, signals from the brain, this is the motor pathway, the movement pathway, come from the movement part of the brain right through your neck where the spinal cord is. It's in your vertebral column. The bundle of nerves called the spinal cord goes through and keeps sending out branches to supply arms, the trunk, and the legs at the appropriate level. Okay? So, for example, say this is a muscle bundle. The nerves from the brain, we call it synapse, connect with those little star-shaped cells, and if those star-shaped cells are affected, you go paralyzed. Okay? So the signals may still be going to the brain, but there's nothing coming to the muscle. So please understand that's how the brain works. So signals must come down to the muscle to keep the muscle growing and active. Equally, signals must go up roughly the same way to the brain so that the nerves kept stimulated. Okay? So both the nerve and the muscle must be stimulated for both to be active. So that's normal. So what happened again in polio? So we call it, can you see one nerve with all its branches is called a motor unit. In polio, the motor units were affected. So one died. You saw this is a different picture before. This is another version of it. Just the same story, just a different picture. One motor unit died. So you are now dealing with, instead of 2 motor units supplying that muscle, you only got 1. So what happened at recovery? That one sprouted new legs, more. So then it worked for you because you stimulated the muscle, because you moved, you demanded action, and the muscle gave you the action, the nerve sprouted. Okay? I must have lost one. I'm so sorry. So that's normal muscle, yeah? There should be one more picture, isn't there? What happened in late effects of polio, the new sprouts, I'm sorry, so I forgot to paste another. The new sprouting, what says new sprouts? In late effects, the new sprouts die back. So your muscles are still working, but it's working less efficiently now. Okay? It's still there. And now, so again, just a recap of what we have been through before. Muscles will maintain strength with appropriate input. Now, this is a simpler, the first part was complex. This is just the take-home message. If you forget what I've said, at least please remember this. Muscles will maintain strength with appropriate input. This is normal muscle behavior. Muscles will lose bulk and weaken with disuse. If you sit around, muscle is going to waste. It'll be smaller and it'll weaken. Muscles will lose power when strength reduces. So if you don't have strength, you can't move fast either. So strength and power are interlinked. Therefore, you cannot respond as fast as you could before. Muscles demand optimum nutrition for function. So it's not how much you eat, but what you are eating that's important. Please remember, if you're unsure, go to a dietitian. To recap, there are 2 main types of fibers. There's fast-acting, contracting fibers. These are your running, moving fast fibers. Then there's the slow contracting fibers, right, so that demands static contraction. Fast contracting fibers are strengthened by overloading in a normal muscle, okay? That's the point I made. I take you right to the point of being tired for a normal muscle. I will talk about polio later, but this is how we do it normally. That's where the confusion comes. If you go to a sports physiotherapist or a sports trainer, that's what they're used to doing. All right? So you are one of many patients, which is the problem. It's not that they don't know. They're just seeing so many. They forget to tune in to your needs. So again, please, I also support the statement that was made. If the bigger group that you are, the better representation we can make so that your needs are met. Okay, fast contracting fibers are strengthened by overloading. This allows for rapid power movement. So if I overload your muscles, I can train your muscles to respond faster. Normal muscles, slow contracting repetitive training. Repetitive training increases the ability of the muscles to use oxygen effectively. So I've got to do something again and again and again. This confers increased fatigue resistance, for example, treadmill walking, cycling over long duration. You can walk, but that's also loading your joints. So these are a little bit more non-weight bearing, but nevertheless, you have to do it for long enough to get the energy. Consequences of selective training. When a patient undertakes low intensity repetition exercise, low intensity means not so much loading, but you're doing it again and again, the fast twitch muscles are not recruited, okay? You're recruiting selectively only the slow twitch muscles. And therefore, the fast twitch muscles, because you're not using them in your training, they will atrophy, they will get smaller. At the same time that the slow twitch fibers are hypertrophy. So, if you do an exercise repetitive, I go for long walks, I'm walking all the time, I'm busy, what you are doing is, yes, you are making your slow twitch endurance muscles bigger, but your fast twitch muscles are fading away. You please got to understand that. So therefore, what's the consequence? Standing still or walking slowly is okay, but you cannot get out of your chair fast or move quickly. So that's what you're doing. When you say, I'm busy and I'm walking around, I'm doing enough. You're not. Normal aging does cause loss of motor units, that is the number of muscle fiber bundles that one nerve fiber feeds. So the bundles that you see will get smaller just because you're aging. Now remember, polio has already taken a few bundles away. So now with aging, you're having less and less. There's another fact that I went through last time. Upper limb strength in normals decreases with age at age 40. So after 40, every one of us, apparently normals, have a 1.5 per year decrease in strength. Beyond the age of 60 and in the 70s, it goes at 3% per year. So that is normal for your muscles. On top of which, this is what the research has shown. For those who have polio, the rate of decrease is 11.2% per year in the upper limbs, beyond 40 years, and 17% from 60 upwards. So you truly, truly have a number of red cards in your hand. 11.2%, and after 40, towards 60, 17.5%. That's the number you must take home. That's how fast your upper limb muscles are decreasing. Your lower limb strength in polio appears to be not age-related, but related to the amount of initial damage. Okay? How paralyzed you are at onset. That is why this is an important question. At onset of your high fever, did your mom say, were you moving your legs? Because that's what's going to tell me, give me a clue. But having said that, again, this is just recap of what we went through, so I might go faster. A large portion of your muscle mass are lost in the rapid contracting fibers, 39% by age 80. That means if you want to use strength, your strength is already going downhill. By age 80, you have lost it at 39, close to 40%. Okay? There's an age-related loss in active motor units, those things coming from your brain to your muscles. Even they are falling at 25% from 20 to 80. So you're having less of those nerves supplying your muscles. Aerobic production, so you can't utilize oxygen naturally by 25% loss as you're getting older. So these are things that are natural, they're acting against you. Take home message, pay attention and do something about it. Okay? There's no point saying, I could do it a year ago, I can't do it now. I'm fine, I'm managing. You will not manage next year. That's the problem. Okay? Inactivity causes, if you are not doing enough, you lose slow contracting fibers. And sometimes they change to fast contracting. Okay? So muscles do change according to the demands you put on them. As I said, so if you're only doing walking, you're going to lose the ability to stand still, the slow contracting, the fibers that allow you to hold something and carry. You may lift something, but you may not be able to lift and hold it long enough to carry it because you are only training your fast-acting fibers. Eccentric lengthening, putting something down, actually trains you better, but it equally also will injure you. So putting something down heavy, you can do it, but you're more likely to snap a muscle when you're doing that. So these all recap. If done with sufficient intensity, even the frail age will respond to training. So you have to do something even if you're frail age. Speed, that is, for example, walking is related to muscle strength, and the ability to move from sitting to standing and stair climbing requires speed and strength. Okay? The loss of type 2, this is your strength fibers from normal aging, disuse and disease, diseases that cause weakness will increase the risk of fall and fractures. Okay? So again, this is just recap. Aging muscles respond to training. I've already said that 3 times now in 3 sessions. Resistance training can improve the central nervous system, that's your brain and spinal cord, recruiting muscles, and therefore they make the muscles larger. Resistance training is the way to make your muscles larger. Okay? And if you want more force in your muscles, you must lift weights. And today's demonstration, pushing something through water is also resistance training. It just depends where you are. So if you're using water, something with a lot of air in it is like a weight that you'd lift on land. Skeletal muscles, all of the muscles on your body will respond according to the demands you place on it. They will respond, but you've got to do some sort of demand. Reduce the demand on skeletal muscles and it will adapt to a lower requirements. Okay? So you're walking, you are climbing when you're working, now you only walk in your home. Accordingly, your muscles will start pulling back in. That is why a lot of people say it's only when I retired that I started to have problems. I was fine while I was working, I got tired, so I decided to cut back, but when I cut back, I got more tired because you did not put the demand on the muscle, okay? You asked the muscle not to do so much. In looking after yourself, you forgot to ask the muscle to also keep working. And so the muscle did exactly as you said. You asked. It reduced its requirements. Increase the demand and the decline due to aging can be minimized, if not eliminated. That's said by this man, Kirk Kendall. He has made that very proud statement. Increase the demand and the decline due to aging can be minimized, if not eliminated. That's very important words. Okay? So recap, I won't go through this. We've gone through this before. You now know what your late effects is all about. Okay? Same thing in different pictures. Changes particular to polio. Now we come why you get what you get. Recovery occurs with fewer nerves working overtime. Okay? From that point of when you started to recover to now, your recovery has occurred, fewer nerves were working, now they're starting to work overtime. Early years, training hard made one nerve sprout and supply a bigger area. With normal aging, the sprouted nerves die back, muscle wasting. Now this is about the 4th time I'm saying this. By now it should be ingrained. Overwork leads to muscle stress and muscle protein breakdown. So if you stress, what is stress? When I feel tired, when my muscles cramp, my muscles stop working, those are all stress. And that stress is due to your protein in your muscle. Remember I said, without protein in the muscle can't build. That protein is being broken down. If you don't have enough oxygen going through your system, the protein is being broken down. Okay? So aerobic and stress. Aerobic is what maintains your muscles. Stress is what breaks it down. And if you stress your muscle, it weakens. So aerobic is the ability of muscles to utilize oxygen and keep working. That's aerobic capacity. Anaerobic is reduced oxygen to the muscle, leading to muscle protein breakdown. Okay, and the muscle protein breakdown can be detected in your blood by this test for creatinine kinase, the same thing, creatinine phosphokinase, CPK or CK, it's the same thing. So if it's high in your blood, your muscles are working overtime. If it's not high in your blood, there may be other reasons for your fatigue. Don't ignore it, okay? So they have to go looking for it. It just means, if your blood is normal for CK, it just means your protein, it's not your muscle breakdown that's causing the fatigue. You still have to go looking for the answer. That's why, yeah? All right. Causes of late effects of polio from a physiotherapy perspective. We think the late effects of polio from our perspective of muscles, joints, and brain come from muscle overuse. Your motor units eventually degenerate, causing slow weakness and rapid fatigue of muscles. Okay? Slow weakness and rapid fatigue of muscles. That's what we think happens. You have loss of motor units with aging, so that you've got asymmetry of limbs. That's the other cause of late effects. Your one side of the body is not the same as the other side. You have degenerative osteoarthritis. Just saying I've got arthritis is just making a statement. Okay? What you need to understand, yes, everybody has, my doctor said I have osteoarthritis. So has everybody else from the age of 30. Degenerative osteoarthritis sets in from the age of 30. The problem is, in your case, your asymmetry is causing it to accelerate. Okay? So you have to be as symmetrical as possible. You increase, and what happens in degenerative OA, you know that. There's increased pain. Once you increase pain, you decrease function. Everything then starts to flow. You decrease function, you got disuse. Okay? Now you got disuse, you got loss of muscle strength. Then you got more asymmetry. Can you see how any which way you look at it, there's a vicious cycle. Pain inhibits muscle contraction. Increased sedentary lifestyle with age. That's the other reason why you all have the problem. You actually are sitting around more than you realize. And you know that too. You think about what you did at age 40 and when your kids were around. Of course you're doing less. Because I'm tired. And the physio said, take more rest. Okay? True. But it's the balance that you've got to understand. So if you have a sedentary lifestyle, you leads to increased weakness due to disuse. That's the other one. So you've got disuse from sitting around. You've got disuse from asymmetry of your limbs. Okay? Two big causes. Then, of course, comorbidities. Again, I say the sleep apnea is a very important problem. Please have it addressed. Rheumatoid arthritis, any arthritis is a problem. Have it checked out. Don't just take medications and say, I'm fine. Use of muscles at a higher level of capacity. A weak muscle having to do the same amount of work as a strong muscle. For example, your stomach muscles were not meant to be used as walking muscles. They were meant to stabilize your body so that your legs can lift up. What happens as your leg muscles weaken, and one of the biggest muscles to go in the legs in polio is the muscle that actually lifts your leg up. It's the flexors. Okay? They start to weaken. What you do, you're still walking, but now you're doing your stomach muscles. You're using the stomach muscles to help lift your leg. And that's how we teach you to trick a movement. But you did automatically. What happens then, these muscles were not built for that. They were not built to lift your leg fast and strong. They were only meant to hold still. So they don't have the muscle fibers required. They actually are working differently. Now, you've put a lot of demand on a muscle that doesn't have that lifting fiber. Of course, you're going to tire out. So can you see? You are demanding of muscles that don't normally do the function to work for you. And they will weaken faster. So, that is why a physio will know. If you start substituting, sometimes you have no options. You have to substitute. But when you substitute muscles, please understand you're also fatiguing them if you don't train that muscle to work. Muscle substitution increases the energy expenditure for the task. So when you walk with your stomach, you start tipping sideways. You can't step. And most polios will do that. You think it's your sticks that are causing it. It's not. You're using the stick because you're starting to weaken in your stomach. And once you substitute muscles, that's more energy, and therefore you get tired doing something simple. I've already said that, yes? So then the other is use of ligaments for stability. That's the other problem with late effects. So the more you hyperextend, the more you push your knee backwards to try and walk, the more you are stretching, the more loose-limbed you become. That compensation is causing a lot more stress in the rest of your body, if not that leg. Okay? Now, but having said that, once you go too far in pushing your knees back, there's very little even an orthotist can do. They can't brace you because your ligaments are so stretched. They really cannot, because for them, mechanically they can realign your caliper. So they lock your leg in to a perfect alignment, but you won't be able to walk with them, which is why many of you say, I had a perfect caliper, I could stand on it, but I couldn't walk. Okay? Because he changed the alignment of your body, because you had stretched the ligaments so far that the brain now cannot understand how to work this muscle. So compensating for too many years, it doesn't do you any good. And therefore, the other thing that makes you very tired, as we say in terms of in physiotherapy, is once you start to think about every movement you make, you are going to be more tired, because then you're going to walk less. And split attention, we talked about it in falls, okay? So what is posture now? Posture, second is stiffness. Posture, the first picture is perfect posture. But you only think, oh, well, I just look a bit bent. It's not the look a bit bent. The last picture shows you what's happening to the spine. So when you are changing your posture, you are changing the position of your spine, and that's the problem. When you remain long enough like so, you're going to be bent. And nothing you can do will straighten it, except to tip backwards. Because you can't just brace yourself and straighten. So posture secondary to a stiff spine. Okay? So very important, keep your spine mobile, think about what is normal posture, because the longer you stay bent, the more permanent you stay bent. The other, there's perfect balance and consequences of small shift of body weight. The first picture is perfect balance, meaning a line going from the top of your head must pass through the middle of all of those joints, right down to your leg. That's how precisely balanced your body is. You shift. How many of you are in that second picture? What you've done is now tipped your pelvis forward. Now these are bones. You can do that because all of your bones have changed. As soon as the bone starts to change, your center of gravity starts to shift. So some of you are leaning forward. That's what you're doing to your spine. You shifted every muscle, every joint, every ligament in your body into this position. Some of you are stiff. You shift backwards. Same thing. You just shifted your center of gravity. So you got nowhere to go backwards, remember. There's no brace, nothing we can put behind you. So that is why you tend to fall backwards more than forwards in a sense. So you will change your spine. Small shifts in center of gravity will change your spine. And if you hold it in that position for long enough, you've now got a stiff spine and you're there forever. Just going through again, balance and normal movement are the reverse of the same coin. If you have normal movement, you have balance. If you have balance, you should have normal movement. Okay? So you change one, you change the other. We went through all of this the other day, so I won't go through this again. Okay? But to say muscles, stiffness, eyesight, fatigue, medications, poor shoes and orthotics will all cause problems with normal movement. If not a fall, they will cause problems with normal movement. So in summary, self-management starts with understanding how your body works, right? Because the next session, the how-to, does require a bit of concentration. It's a short presentation, but does require to concentrate on how how prescriptive the exercises have to be. It's a bit complex. So please understand again, I'm going to start from this position of, we understand aerobic and anaerobic. Those are the two words you must understand. We are looking at fast twitch and slow twitch fibers. And please understand the why of your problem is, if you don't demand of your muscle, the muscle will waste. If your muscle wastes, you have reduced strength. Please do not discount nutrition. It's not how much you eat, it's what you eat. That is very important. And if you're uncertain, go to a dietitian. Because we all think we know what diet is, but not many of us do. Protein is very important. Not all oil fats are bad for you, so please, it's not just a matter of dropping fats and dropping carbohydrates. Every one of you who's using a caliper is using high demand. You're working you need a lot of energy. And if you're not putting the energy back, quick energy comes from carbohydrates and sugars, okay, and complex starches. So you must have enough of that. So don't go extreme dieting either, because then your muscles will waste. You know why? Because you're burning them. You're demanding a lot of your muscles, and you're demanding a lot of a selection of muscles. So in your case, you're demanding a lot from your arm muscles. And that is working overtime. Okay? If you're sitting in the wheelchairs, that's why you find it hard to lose weight. Okay? How do you do it? I'll talk about it later in the how-to. Okay? You've got to find a way of not only increasing your cardiovascular fitness, how to control your weight gain, because it's a catch-22, isn't it? The heavier you are, the harder your arms have to work, more strain. Okay? So that's a catch-22. So let's come back